Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about depression, and joining me now is licensed social worker Amy DeLange. Amy, you are a licensed master's prepared social worker at McLaren Port Huron's Outpatient Counseling. I don't know if a lot of people know, but the social workers typically are the ones who provide therapy for individuals. Is that correct?
That is correct, Michelle. Thank you for having me. It can be very confusing with the term social worker, but social workers are the preferred providers for therapy, what we consider talk therapy.
So what treatment options are available in the outpatient setting for depression?
We offer several options in conjunction with medication often that's prescribed by a psychiatrist. The first would be traditional individual outpatient therapy, where an individual would come in and see a therapist approximately once a week for individual counseling, and they would with depression they would talk about triggers, symptoms they're having for depression, and that therapist would coach them on particular coping skills. Secondly, we also offer group therapy, where individuals come in and they meet in a group setting, anywhere from 2 or 3 individuals to maybe up to 10 at a time, typically for an hour in different segments once a week. And this helps individuals explore and discuss similarities and experiences they may be having with others, and maybe even learn coping skills from others. And lastly, we have family therapy as well as marital therapy or couples therapy. And that would help individuals explore ways to help their loved ones in coping with their depression, as well as learn ways to communicate better with their loved ones as they're coping with their depression.
How does therapy help with depression?
There's many ways that therapy can help with depression. First and foremost, it provides a supportive, confidential, objective environment for an individual to come to. And secondly, a therapist can help an individual identify particular stressors, triggers that may be causing depression, and how to cope with that. Therapy also addresses particular distorted thinking or thought patterns that someone may develop that could certainly contribute to symptoms of helplessness and hopelessness.
So if somebody schedules their first appointment for therapy and they don't know what to expect, how long would you typically say they would need to come and see you?
Traditional therapy for depression would be once a week, approximately 50 to 60 minutes per session, and we would look for that to last, depending on the severity of the depression, but 9 to 12 months. Now certainly there are times where with severe depression or persistent depression, the first phase of treatment we might recommend multiple times a week for individual outpatient, maybe 2 or 3 times a week, and we might do that for 3 to 4 months at a time and then titrate that back down to once a week. Other conditions of depression, more mild to moderate, someone might only come in for outpatient therapy for 6 to 8 months.
Can you talk a little bit more about what someone can expect to occur during that 50-minute session?
Well, as a therapist, I like to think that we're more of a coach or a guide. One thing that I often say in therapy is it's not a car wash. You don't come in and expect to get washed and be all better. We look for the individual seeking treatment to work alongside with a therapist. And very often when someone comes into therapy, there certainly is a time to vent and then explore some of the symptoms and the triggers that are happening during depression. But we often give homework assignments, and then you'll come back to therapy the next time and discuss those assignments and hopefully grow from that. Meaning that we expect the person that's seeking therapy to work with the therapist and not expect to be fixed, if you will.
Amy, tell us a little bit about the group therapy sessions that are offered at Outpatient Counseling.
Yes, we offer several different topics. They're set up in 6-week sections, so every 6 weeks we'll offer a new topic, and they run for approximately 60 minutes. Some of the topics that we're offering are coping with weight loss struggles, coping with chronic medical conditions, coping with grief and loss. There's various topics that will occur throughout the year, and we're looking for individuals to join those group sessions at the clinic.
How do people register for those group sessions?
You can call our clinic and just say you would like to enter one of those group sessions. I know that they're posted on the McLaren Port Huron website and Health Access. We have posted flyers throughout the community as well at particular physicians' offices, for example. for example. And we can bill most insurances.
Amy, do you provide any therapy for children or teenagers at the Outpatient Counseling Center?
Yes, we do, Michelle. Therapists will see, I in particular will see children down to 10 years old, and our psychiatrist, Dr. Brozovich, will see children, adolescents starting at age 14.
How common is it that a child or a teenager would experience symptoms of depression?
Well, children and adolescents are experiencing a lot more stressors these days than I think they were formerly 10, 15 years ago. An example would be the social media that's out there, whether it be texting, different types of messaging, cyberbullying. All those influences cause a situation where parents may not even be aware of what's happening. And it also decreases that face-to-face communication or social interaction that children and adolescents are used to having with other individuals.
Some parents may feel uncomfortable discussing the topics of depression or suicide with their child. Do you have any tips for how they can better manage that?
Well, first and foremost, as difficult as it may be, if a parent or a loved one or a concerned person suspects that someone may be depressed or even suicidal, saying the words, asking it out loud is very critical, as difficult as it is. Asking, are you depressed? Are you suicidal? Have you thought about suicide? Do you feel sad? Do you feel hopeless? Putting those words out in the open space is very helpful. And if you're that uncomfortable with doing that, schedule a therapy appointment. Even if it's just for an initial evaluation, there's no harm in that. And the individual might not need long-term therapy. But if they do, we'll schedule them for therapy as well.
How can parents or loved ones of anybody who's experiencing depression be supportive and helpful in encouraging care and in encouraging healthy habits at home?
Well, there's numerous things you can do at home, either as an individual or help as a loved one. Believe it or not, sleep is very critical. So good sleep, 6, 7, 8 hours as an adult, and adolescents and children, we look for increased time of that, maybe closer to 9 or 10 hours a night. Diet is very important. So, as a parent, making sure that your children are having a good diet. As an individual, making sure that you have a good diet. Along those lines of what do I mean by good diet? Breakfast is number one. Try your best not to skip out on breakfast. Eat a healthy, good breakfast. Staying hydrated, drinking a lot of water is very critical. It helps give us energy, believe it or not, and it promotes overall health, helps us from getting headaches. Water is very important. And food rich in nutrients and vitamins are very important. Of course, most of us think of fruits and vegetables. But when we think of fruits and vegetables, we want to eat things with a lot of color. The more color, the better. Easy things to eat: berries, strawberries, blueberries, nuts, lean meats, eggs, things with protein. All of those things that come into our diet are very helpful for us. So diet is critical. Vitamins, some people take vitamins. So a lot of the vitamins that help support mental health out there, physical health as well. Vitamin C, vitamin E, the omega-3s, the good fats that we know we should be having, beta-carotene, selenium, those are things that we might take as a supplement to help support our mental health. Exercise is another key thing. Again, parents can promote a healthy environment by including exercise in their family routine. As an individual, you can seek exercise. And you can do exercise for free. What's out there as a standard is 10 minutes a day, every day, or at least 3 times a week of 30 minutes of exercise. Something as simple and again free as walking or bike riding that can be done. So exercise, movement is the key, with exercise being very important. And of course, we want to stay away from caffeine, sugars, alcohol, non-prescribed illicit drugs. We want to stay away from that as well. And lastly, and maybe most importantly, is building a good support system. And if you don't have that, working with your therapist to help you build a good support system would be very appropriate. And then once you have it in place, learning how to access that support system when you need it.
Now, you mentioned earlier the difficulty with communication with all of the technology in today's age where people are texting and messaging. How does that affect developing healthy relationships, and what can people do to help promote that healthy interaction and developing the support system that you're talking about?
That is certainly a barrier that's out there, and it's something that for me comes up in therapy quite often. And I have gone to the point of advising individuals I see to, as much as they can, to decrease their texting. If you have a family and a family member and you want to talk to that person and they're in the same house, make that move to go talk to them. I've worked with a number of individuals that tell me I text my husband or I text my wife and I'm in the bedroom, they're in the living room. I text my son because he's upstairs in his bedroom. I really try to encourage individuals to have as much face-to-face contact as you can with your loved ones, your family members, your friends, your co-workers. You know, there's been times where we text our coworker or we could walk right down the hall and talk to that person face to face. So research shows that there's nothing better than face-to-face contact.
Amy, this has been great information. Thank you for joining us today.
Thank you, Michelle.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.